Bismillah ar-Rahman ar-Rahim. My subject is epistaxis, presented by Tabarak Ali Abdel Kalam. Epistaxis. Bleeding from inside the nose is called epistaxis. Seen in all age groups. Present as an emergency. Epistaxis is a sign and not a disease per se. Now, blood supply of nose. Nose is richly supplied by both the external and internal carotid system, both of the septum and the lateral walls. Now, the nasal septum is supplied by the internal carotid system and external carotid system. The internal carotid system have two branches, anterior ethmoidal artery and posterior ethmoidal artery, both of them branches of ophthalmic artery. Now, the external carotid system is supplied. It has three branches: sphenopalatine artery, branch of maxillary artery, gives gives nasopalatine and posterior nasal septal branch. B. Septal branch of greater palatine artery, branch of maxillary artery. C. Septal branch of superior labial artery, branch of facial artery. Now, the lateral wall. The lateral wall is supplied by the internal carotid system and the external carotid system. The internal carotid system has two branches, A. Anterior ethmoidal, 2. Posterior ethmoidal, both of them branch of ophthalmic artery. Now, external carotid system has four branches: posterior lateral nasal, supplied from sphenopalatine artery. B. Greater palatine artery, supplied from maxillary artery. C. Nasal branch of the anterior superior dental, supplied from infraorbital branch of maxillary artery. 4. Or D. Branch of facial artery to nasal vestibule. Now we come to the important area into nose. It's called Little's area. It is situated in anterior inferior part of the nasal septum, just above the vestibule. 4 arteries: anterior ethmoidal, septal branch of the superior labial, septal branch of the sphenopalatine, and the greater palatine. Anastomosis here to form a vascular plexus called Castle plexus. This area is exposed to direct effect of inspiratory current and to fingernail trauma, and it is in the usual sites of epistaxis in children and young adult. Now, in this slide show us the Little's area, which is contained of Castle plexus. The plexus, which is formed from a multiple artery, اللي هي anterior ethmoidal artery and posterior ethmoidal artery, sphenopalatine artery, and internal carotid artery, و greater palatine artery, and superior labial artery. So, now the sites of epistaxis. 1. Little's area in 90% of cases. 2. Above the level of middle tuberosity. 3. Below the level of middle tuberosity. 4. Posterior part of the nasal cavity. 5. Diffuse both of septum and lateral nasal wall. 6. Nasopharynx. Now we have the classification of epistaxis. anterior epistaxis and posterior epistaxis. The posterior epistaxis, blood flows back to the throat, cough-card vomitus. Now, we have the difference between the anterior and posterior epistaxis. Incidence site in the anterior epistaxis more common، بينما بالposterior epistaxis تكون less common. بالanterior epistaxis تكون mostly from a little area or anterior part of the lateral wall. بالposterior epistaxis تكون posterior superior part of the nasal cavity. Age بالanterior mostly occurs in the children or young adults. بالposterior after 40 years of age. Cause بالanterior mostly trauma, and بالposterior subcutaneous, often to hypertension or atherosclerosis. Bleeding بالanterior epistaxis usually mild, can be easily controlled by the local pressure or anterior pack. بالposterior bleeding is severe, requires hospitalization, spot nasal pack often required. Now, what are the causes of epistaxis? Local causes and systematic causes. Idiopathic 85%. Local factors: noise picking, noise blowing, nasal fracture, and other. Systematic factors: vascular anomalies, bleeding, diathesis. Medical conditions: a hepatic failure, renal failure, and HIV. Medications: warfarin, aspirin, Plavix. Post-operative sinus surgery and spitoblast. Now we have the management of the epistaxis. The management. In any case of epistaxis, it is important to know: 1. Mode of onset, duration and frequency of bleeding. 3. Amount of the blood loss. 4. Side of noise from where bleeding is occurring. 5. Whether bleeding is of the anterior or posterior type. 6. Any non-bleeding tendency in the patient or the family. 7. History of the non-medical elements, hypertension, leukemia, and others disease. 8. History of drug intake, analgesics, anticoagulant, and other. Now, first aid. Pinching the nose with the thumb and index finger for about 5 minutes. This compresses. Now, the first aid. Pinching the nose with the thumb and index finger for about 5 minutes. This compresses the vessels of the little area. In Trotter's method, patient is made to sit leaning a little forward over the basin to spit any blood and breathe quietly from the mouth. Cold compresses to the nose to cause reflex vasoconstriction. Now, the cauterization. Cauterization. In anterior epistaxis, when a bleeding point has been located in this area, the area is first anesthetized and the bleeding point cauterized. Now we have the method of electrocautery and electrocoagulation. Another way to treat the epistaxis is the anterior nasal packing. If bleeding is profuse and or the site of bleeding is diffuse, to localize anterior picking should be done. One or both cavities may need to be picked. Can be removed after 40 hours as bleeding has stopped. If it has to be kept for 2 to 3 days, systematic antibodies should be given to prevent sinus infection and toxic shock syndrome. And thank you.